Right, hello, welcome everyone. Right, today we're actually going to be speaking about this career talk about dentistry. Right, today we're very fortunate to have Dr. Khaw and Dr. Tay, right, to speak to us about this particular course. Right, I think without further ado, let's introduce both of them to you guys. Dr. Khaw.
Hi everyone, I'm Qing Ling. So I was Mr. Lucas' student 8 years ago in Taylor's. So I'm a dentist who is working now in my hometown, Penang, Malaysia.
Dr. Tay.
Hi guys, my name is Keith. I'm also one of Mr. Lucas's students, and I'm a dentist in the UK.
Right. Thanks for being here. Right, spending your weekend over to come and speak to us. About this particular course. Now, a fun fact, right? My students used to actually ask me, how come my career talk so far has only featured what they call these two speakers from the same gender. Today we have two different genders. All right. Not that I planned it, but yeah, it happens that I actually managed to get Dr. Khaw and Dr. Tay to speak to us on this particular topic today. All right, so dentistry, right? It's basically a very, very challenging course to actually do. It's very competitive as well because I remember it's actually right up there, on top in terms of whatever skills that you're required, attributes that are required, right, for apply for this particular course. So maybe can share with us a little bit what are the motivations that were going through your mind, that make you chose this particular course when you were actually deciding the time. But what made you choose this particular course?
Um,
Dr. Kha?
Okay, so I've always known that I wanted to do a healthcare profession. So I was in dilemma in between medicine and dentistry while choosing my degree. So I actually joined a field trip in like international medical universities to their faculty of dentistry and faculty of medicine. So I spoke to their students and the lecturers gave us a career talk. So in the end, I decided to choose dentistry as my profession because I knew that I was inclined towards the work that require the hands-on approach, and dentists work a lot based on the practical application of the knowledge that you have. So I'm more towards a hands-on kind of person. So I chose dentistry as my career, yeah, rather than medicine in the end.
and for me, I didn't know that I was going to be a dentist 10, 12 years ago when I finished my SPM. I had to speak to a lot of family friends and then with regards to like application and stuff like that, because I wasn't sure what I was going to do. I knew that I was going to do A levels, but I wasn't sure which career pathway that I was going to go down to. I was in between two minds of actuarial science or dentistry. I know for sure that I didn't want medicine because I've got family members who are doctors, and I just don't think I can deal with that. I'm a very emotional person. I I cannot take it if people pass away or die in front of me, and just is not something that I can make basically cope with. And I do think that dentistry is for me after I've actually seen some of the work that a dentist that I shared it with, and I do think that that was a career path for me, and that's why I went after that job in the end when I applied for university.
Both of you studied in the UK, right?
Yeah.
There's a
Yeah.
5-year course over there.
It's a 5-year course, yeah.
Dr. Tay, you were from which university again?
Yeah. So I graduated from University of Glasgow in Scotland.
Yeah, and I graduated from University of Dundee in Scotland as well.
Yeah. Oh, such a coincidence again. Both of you actually graduated from Scotland. All right.
Yeah.
Yeah. So okay. They always say, right, when two strangers first meet each other, right, the first thing they realize is actually the smile. Is it true? And
Yeah.
so yeah, Keith.
No, it's true, because if you remember, there was an advertisement a long time ago. It's actually hair care, but the guy that did it was very smart that they hide the person's eyes, the model's eyes, but only showing their teeth. And it highlights to people that that's the first thing you see in someone's face.
Okay. So Dr. Tay and Dr. Khaw, for students who are actually looking to apply for this course, what kind of attributes that they need to actually have in order to actually be, able to do well in this particular course? Do they need to have a certain set of skills, attributes? Do they need to be good in certain subjects in order to actually do well in this particular course?
I think to do this course, obviously you need to be doing science subjects when you're doing A levels. So you need to be doing chemistry, biology, math, or physics. But I think that you need to be obviously you need to be getting good results to apply for dental school. And I do think that you need to have certain characters, you need to have certain attributes when you are thinking if this job is for me. And I think the main one for me is honesty, and also being a very pleasant, welcoming person. Honesty will get you far in life, and so does dentistry, because you need to be honest with the patients of what is achievable, what is unachievable, and then you need to be honest with them. There's no point sugarcoating stuff when things don't work out, because at the end of the day, you are a medical professional. You need to be responsible for whatever you say. Hence, I think that if you're an honest person, if you're an honest character to start with, I do think that it doesn't matter dentistry or medicine or pharmacies. I think it's a very good quality to have if you're going to be a dentist. And that's my take on it. And obviously you need to get at least 3 A's for dentistry. Yeah.
Yeah. So I agree with what Keith said. And in addition to honesty, I think a dentist should have a good teamwork spirit, because a dentist is not working alone with the patient. They need to work with the people surrounding, like dental nurses, dental receptionists, hygienists, dental technician, in order to provide a holistic dental care for the patients. And a dentist should be able to communicate and interact well with the people surrounding as well, with the patients, with the kids' parents, and with all the people surrounding. And I think a dentist should be rational and be able to make a decision rationally, and have a good decision making as well, in order to plan a treatment plan for the patient's dental care. Yeah.
All right. It's such a competitive course. How many international students your respective universities took every batch?
So I guess it depending on the year. My year has 58 students in total. We have 11 international students, and 10 out of 11 are actually Malaysians. And the year before me, they have 70 students, and 20 of them, they are international students. 10 are Singaporeans and 10 are Malaysians.
And for me, it's slightly different. My year, we had 10 students from Malaysia. Oh, no, actually, international students. 7 of us are from Malaysia and 3 of them are from Singapore. But it really depends on the year, like what Dr. Khaw was saying, because the year below me only had 5 students, and the year before me only had 2 or 3 students that are international. So it really depends on the university. And I do think that every year it changes. So it's a good idea to check it beforehand before you apply.
What are the things that you'll need to do before you apply for the course? Is there an entry, what they call this exam that you have to take? What are the preparations?
I think Dr. Khaw will agree with me that you need to do a 2 weeks attachment with any of the clinic. This is when you're in A levels. It's just that you need to show that you've got some shadowing experience and you know what this job entails. Then I think you need to do a clinical aptitude test, which is called UK-CAT. It might have changed because the last one that I took was a long time ago. And then you need to score a good score in order to get an interview. And I think Dr. Khaw was talking about IELTS as well.
Mm-hmm. That's right. So we did the UK-CAT, but maybe I think it changed the name to just UCAT rather than UK-CAT. So it consists of a different of the aptitude test, like a verbal reasoning, the situation judgment test, and then like a numerical reasoning, like different parts. And IELTS as well, personal statement is important, and all dental school require interviews prior to get into their school.
So it's very, very competitive. So those who are actually applying for this course, make sure you actually do your homework, right? Make sure you actually be prepared. Make sure you firm up a decision early. I'm sure Dr. Kit will agree with you. Agree with me, sorry.
I do think that going through my own journey, I plan everything in advance, but I didn't know why did I do what I do 10 years ago when I applied for dental school. But my recommendation is that start early, because I'm gonna be honest with you all of you that I actually didn't apply. It was the 15th of October, I still remember. It was the day that Oxbridge Dentistry and Medicine, I think that is a deadline for application, and I applied it quite late because at that point I was just, when I was telling you guys I wasn't sure what I was gonna do, and when I've decided that, I think the only advice that I would give to anyone for that matter is that don't leave things to the 11th hour, because you will regret. But thank God it all worked out for me, because or else I'll be kicking myself, right?
All right, thanks. All right, how was your study life like? It was a 5-year course. How was it like? Any specific highlights that you can share with us?
Okay. So for my dental school, I mean, when it's still following the old curriculum, but it has changed now, I believe. So for me, my first 2 years were actually the pre-clinical years. So we studied the subjects like physiology, biochemistry, anatomy, microbiology is almost as similar as the science that we studied in A levels. And towards the end of the second year, we started doing some clinical work. And from third year onwards, we actually started treating the patients under the supervision of our specialists and consultants in the hospitals. And my highlights will be definitely my fourth year, because at the end of my fourth year, our dental school require us to do a compulsory 4 week of the elective program. So it can be anything that you want. You can just shadow any dentist, like being a cosmetic dentistry, or forensic dentistry, vet dentistry. And a lot of my colleagues and I, we chose to go to overseas to do our elective program, like through the charity organization. So I did 2 weeks of the dentistry in Cambodia through a 1-to-1 charity organization. So, and we went to prison as well. So I have some pictures to show you guys. We actually treat all the students there. So it's quite fun. Can you all see?
I can see Mr. Lucas.
Oh, no, it's okay. I don't know where the pictures. No. Yeah. Okay, so yeah, we actually so with all the locals, we even went to the prison to provide the dental treatment to the prisoners as well. So that's the elective program. And for our final year, we have our outreach program. So basically, we just go to different parts of the Scotland, the community dental services, to provide the dental treatments to different parts of the community in Scotland. So we have like we have the 1 week outreach, like in certain places that we get to pay to live there, stay there for our and we get to treat the patients there, and the clinicians there are really friendly. Yeah.
Yes. Throughout my experience was similar to Dr. Khaw, because obviously we were both graduated from Scotland. But my experience is that within the 5 years that I was in uni, I've made some really, really good friends that are obviously Scottish, because they are all from Scotland. And the whole experience was very enjoyable. I've taken some pictures that I think we are going to share the screen on here. So I'm just going to go through that. I'm going to share the screen now.
That's nice. The very first time someone in the career talk actually shares picture.
So I went to Glasgow because when I picked the universities, I don't think you all should do it the way that I think, but when I thought of the universities that I applied, I actually looked if there's an international airport there. It's important if you are not from the UK and you want to go home. The last thing you want is that you have to take another 2 hours train to go to an airport. And then Glasgow has an international airport with KLM or Emirates flying in. So it's just easier for me to go to. And Glasgow was one of the best dental school, and it still is one of the best dental schools in the UK. And come on, look at the university. This is where you're going to be graduating from. It's such a beautiful university. This picture doesn't do the judgment because it's a huge university. I've only taken the picture from far away, but I don't have any pictures that are close up because I've lost my phone at one point. So all my pictures gone missing for like from 2014 to 2016. So part of my memories at university are all gone. But anyhow, it's a beautiful university. And this is where I obviously went to study the Glasgow Dental School, a hospital and school. So it's a tall building. It's 8th floor or 9th floor tall. And then we do our treatments there. We have most of our lectures there. And then across the road, there are a lot of restaurants and stuff like that. The whole experience was very enjoyable because in the early years of your dentistry, you start seeing patients in your first year. You will take your first set of impressions. I don't remember it was a patient. I think it might be one another. In Glasgow, they focus more on peer-assisted learning. They do focus more. They do focus on main lectures, but they also promote peer-assisted learning, meaning that your peers in the years above you will sort of teach you. So the years in like year 4 will be teaching year 1, and then year 5 and year 3 work together in like a root canal clinic and stuff like that. So it's a lot of teamwork within the years. And then within the 5 years of dental school, you get exposed to clinical experience at a very early in your clinical stages. So you knew what was going on all the time. It's not just basic physiology, basic anatomy and stuff like that. It's a lot of things, but they spread out within all the years that you're there. And then I still remember that one of the most memorable experience that I don't think, I do think other dental school do, but obviously I didn't go to other dental school to study. But when we're in 3rd year, you'll be studying in the main university campus for, I think, few months. You'll be doing your anatomy session, and there are cadavers there for you to do the anatomy session. So within 5 students, there's a body there for you to share. And I still remember I was the first one who did the anatomy, like it was a fresh cadaver. So I still remember we did our first anatomy session, incision and all sorts around the throat area and all sorts. And that was a good experience I think that I had. And then obviously the highlight of my whole 5 years of dental school was when I was in final year. In Glasgow, there was no lectures in final years. You are working as a safe beginner or safe practitioner level. So you will be paired in outreaches like what Dr. Khaw has to a residential outreach and a long-term outreach. And it depends on, I don't know how they figured it out, but if you're going to this center, you're attached to one residential area. I'm going to show you guys a picture of, this is my main center. It's called the Vale of Leven, the Vale Center of Health and Care. So there's 2 clinicians there, Dr. Dixon and Dr. Cox, that are there to supervise us. So this is my 1 week in community, so my outreach program. And another week, I'll be in hospital rotating between different specialties within dentistry. And then the residential outreach is actually the highlight of, I think it's actually one of the highlights of this course, is that the dental school will arrange like a flight for you guys to go to this small center called Campbelltown Dental Center. You will go there on the Monday morning. So early morning, you will wake up at 6 o'clock. For 7 o'clock, you will gather outside where the dental hospital is. There'll be a cab that drives you to the airport, and you'll be boarding the flight, and then you'll be arriving at Campbelltown Airport. And then you'll treat patients there from Monday to Friday, staying at an accommodation that is all paid for by the dental school. And I cannot tell you, this has been such a good experience in my life that I don't think that, I'm not a very nature person. I'm more of a city person, as most of us would be, because if you're born and raised in Malaysia, I don't think that you will be flying to a rural area in the plane, that you fly across the Isle of Arran. I mean, in Malaysia, you will fly across Pahang and stuff like that for me when I go home, but it's such a different experience when you're in a different country studying a course that most of your mates, like most of your peers would be doing in Malaysia. But I think that if you come to the UK, it's just a different experience that you will get if you study here. That's my highlight of the whole journey. And I'm still working here And I do think that Malaysia has good, I just don't think it's the right time for me to go back just yet. But that is out of topic. But my main point across is that all this experience that I have at Glasgow for 5 years, it's truly life-changing, because it taught me from someone that comes from a small town, go into a bigger city and live a life that I've never, like, don't go through winter in Malaysia. It's just things like that that are different. And that's my highlight of the whole 5 years that I've been in Glasgow.
Jenny, anything to add on in your outreach programs that you did?
Sorry.
Jenny, is there anything for you to add on for the outreach program that you did back then, or your attachment that you did, the placement you did back then?
Yeah, I think almost similar to Dr. Tay. We also have the outreach program, but it's just to different community areas, because Dundee is towards the east Scotland and Glasgow is towards the west. So we have the different community dental clinics. Yeah, so we went to different parts. Mine wasn't as exciting as Dr. Tay, that he took a plane to smaller rural areas, but we did have a long drive trip down to Inverness. Is another. It's like a North Scotland. Yeah, so it's
Beautiful.
Yeah, I would agree that it's really different from what the final year student in Malaysia might experience. Yeah.
Wow, such an arrangement by the dental school then.
Yeah.
Such a privilege, I would say, especially, Keith.
Yeah, it's different, because when you come from a different country and you go to a different country, you know how people go traveling in different countries. Like if you go to Bangkok, go to Thailand, go to Indonesia, it's the way the people there they do their stuff is different, and it's a good experience. I don't think that if you are just going there for a day or a week, you can experience that. I was there for a week working sort of as a dentist, and it's just a different experience that you have, and you will gain in life. And this is really funny. I don't know if it's appropriate for me to say. I still remember we were in a cab. Me, Robin, Ruchika, and Andrew were in a cab, because we need to get the cab from the airport to accommodation. And we were driving past, because it's rural area, so there are a lot of mountains and stuff like that. And I just look at tiny little lambs, and I just like, oh my god, they are so cute. I just took pictures of that. And the taxi driver just threw down this sentence, and I was absolutely shocked. He just looked at me. That'll be your dinner tonight. And I just went, oh my god, I've just said that the lamb is cute, but I didn't expect that was going to be my dinner. Like, I don't think I would want to ever eat lamb again, because they're actually really cute. But that's something that in Malaysia, you wouldn't have heard that if you just walk past like a farm. Yeah, the chicken's going to be a dinner. No one would ever say that. You get what I mean? It's just a different way. The way they come across is funny in different way. I obviously was shocked, and I still remember Robin was laughing, one of my colleagues. But that's what I meant by it's different.
So, Dr. Tay and Dr. Khaw, both of you actually took different pathway, obviously. Keith, you actually stayed back in UK, right, to progress. Dr. Khaw, you actually came back to Malaysia. And now you're actually working in Penang right now, right?
Yes,
So talk us through how's the process like, applying, for a job in Malaysia. Is there an attachment or compulsory services that you need to do before anything?
So I just graduated last year, so I've been working in a government dental clinic for a year now. So in Malaysia, after graduating, you just need to submit all your documents and to Malaysia Dental Council in order to register with Malaysia Dental Council. And so after that, you will start doing your 1-year compulsory program, which we call it New Dental Officer Program. So that is a 12-month long period of the program. And basically, we'll be posted in a primary dental clinics, and we will have a logbook to be completed. And for example, like how many restorations or how many teeth extractions that you need to be done, that's supervised by your supervisor. And during the 12-month period, there are 2 months that each month you need to base in a pediatric department in the hospital and oral maxillofacial department in the hospital. So, and that you will have the logbook to be completed as well in each department. And besides that, in a government dental clinic, we'll be posted to high school to provide the dental treatments for the high school students. And but due to the pandemic, we stopped visiting the school at the moment, but we'll resume as soon as possible, and we'll be visiting old folks home as well, and we call it the college for the IPG, the college for the teachers, like future teachers. Yeah, so we'll be visiting all these to convey our dental knowledge to them, so that they will be convey the dental knowledge to the future students. Yeah, this is basically my experience in the government dental service for this year. Yes.
Okay, and for me, it's different because in the UK, before you graduate, there will be a time that you will see your dean of your dental school or your director of your dental education to sign you off to get registered with the General Dental Council, which is similar to the Malaysian Dental Council. So when you know that you've passed your finals, the process will go through and the registration will go through and you'll be on the General Dental Council register as a dentist. And then once you've done that, in Malaysia, because the way the healthcare system works in Malaysia and UK is different. In the UK, there's something called the NHS. So once you've graduated, if you want to work in NHS dentistry, you have to go through a year of mandatory training. It will be known as Dental Foundation Training in England and Northern Ireland and Wales, or vocational training in Scotland. When I applied for both. So I applied for vocational training or VT and also Dental Foundation Training, DFT. I ended up going for DFT because I got offered the job earlier. I've got job security before I even graduate. So I don't have to be worried about what am I going to do when I graduate. And the way that this is being conveyed is very structured. So it's similar to your UK CAT. You know, when you first apply for dental school, you need to do the aptitude test. So you need to sit something called a situation judgment test, SJT. Once you've set that, and there will be an interview with like the panels there will be different venues that you can do that. Then there will be a ranking that comes out on one of the days, say the 11th of November, it comes, or I don't think it's this early, but it's ranking from a 1 to 1,000. And these people that are ranked from 1 to 1,000 get to pick, obviously, if you're ranked number 1, you get to pick your first choice where you want to go. There are so many different places that you can go. This whole year is to refine what you've got, your 5 years in a dental school. You're just training. That year is to make sure that you're comfortable with your skills, you're improving your skills, you know how to manage your time properly, you know how to manage your patients, you know how to work in the team. Even though the dental school, it's teaching you that, but like what Dr. Khaw said, that you need to be able to work with different teams. This year that in the UK, the foundation training is actually training you to be in a way to make you more of a qualified dentist. Because after that, you have different career paths that you can go through. I think we'll cover that later on. But by ranking, so what I meant is that if you get ranked higher, you get where you want to go, and it's a fair and square playground. In Scotland, it's slightly different. You will have to travel to different practices that offers vocational training, and you need to interview that with the boss, essentially. If they like you, they will take you. So that's slightly different, but you will always get a place. One thing that I need to make sure that this is the points across is that if you look at the rankings, Complete University Guide, whatever it is, that as an employer, like 99%, I think it's 99 to 100% of their graduates will get a job as a dentist. So this is a good career. It means that once you graduated, you don't have to worry about, oh my God, where am I going? What am I doing? Whether you are staying here in the UK or whether you're going back to Malaysia, because you will always have job security, because everywhere in the world needs a dentist. Yeah.
Thanks for the in-depth, information about the process that you have to actually go. It sounds very competitive for that. There's a ranking system and all. So you get
it's the high school exams when everyone's trying to put it up.
Dr. Khaw, how about in Malaysia? Is there a long waiting period to be posted?
So for me, I'm quite lucky. I graduated in June, and I only waited for 3 to 4 months time, and I started working in October. I know this is different from the medical counterparts. They actually wait up for almost at least a year before they get posted in their hospital setting. So I think dentistry, the period can be quite fast. Yeah.
So
Is
you graduated last year, talking about last year June, right?
yeah,
And you
last
got
year.
posted October.
Yeah.
So you're about to finish that 1 year, you know,
Yes. So
compulsory.
I just finished the 1 year compulsory service in the government dental clinic. Yeah.
Congratulations. That was 2 weeks ago.
Yeah, so that is a compulsory 1 year, and after that you could actually continue to work in the government dental clinic that you are working at, or you can just quit and go to the private dental settings. Yeah.
So yeah, what about specialization? Does I mean, if you after you graduated from dental school, do you just be a dentist? You know, do you do just extract teeth? Do you just do scaling? I don't know. I have very limited knowledge over here about it. So tell us more about it, Dr. Tay.
Do you want to do I think it's different. When you graduate as a dentist, there are so many different career paths. I think in the UK, I think you have a more of a structured way of how you're going to progress in your career. So once you finish the training, some people can decide that they want to go into hospital or they want to go into practice. When you're going to practice, essentially you're going to be a general dental practitioner, like what Dr. Khaw is saying, that a private dentist in Malaysia, but in the UK it's slightly different. But long story short, you will need to be able to do most what dentists could do: extraction, crown, bridge, dentures, root canals, periodontics, which is scaling and stuff like that. But if you know that doing like kids dentistry, if you don't like that, there's also the hospital pathway that would help you shape you into what you want to be. So some people, they might not, you know what, dentures not for me, I'm not doing dentures, but they like orthodontics. So if they're going to go down the road, they could go down the hospital training pathway to be a qualified orthodontist, going through specialty training. It's just that the career path that I took is that I will prefer to do most things. I don't want to be just doing one thing for my entire career. I just want to be able to do more. Hence, I think practice was more for me, because you can do more with the members of the general public if you go down that route. But if you want to be a specialist as well, there's no harm, because specialty is really good at what they are doing, because they have extra training on that one, not just broad, but they are tied into one of that specialty that they are good at. So it has its own pros and cons, and it really depends on what you prefer. But I obviously didn't know how in Malaysia, because I've never worked there before. I think Dr. Khaw will be better for that.
Yeah, I mean, in Malaysia, they do have a lot of different specialties as well. I have yet to explore all these pathways yet, but then basically because now we have this new dental officer program, and we are all the contract doctors. So in order to study specialists, we need to get a job into the permanent postings, and the government will sponsor us to study the master program, and in order to become specialists in the future. We do have different specialties as well. Yeah.
In the UK, I think there are a few. I think it's on the General Dental Council website. There's this one specialty in the UK can be confusing to the one in Malaysia. It's called oral and maxillofacial surgery. This is the career path that I knew that the minute I started dental school and learned about it. Even though I think I know how to do it, but I don't think I want to do it, because in the UK, you will have to be dual qualified. By dual qualified, I mean you need to do dental school and you need to do medical school. Then there will be another few more years of training. I don't think that career path is for me, but it's one of the specialty that is different from the UK and in Malaysia, because I think in Malaysia, you only need to do dentistry to do maxillofacial surgery. Is that right?
That's right, because I did my hospital attachment with the in the oral and maxillofacial department, and both the consultants, they only have the dentistry degree without the medical degree. But what they did are actually the same as what the oral and maxillofacial surgeon did in the UK. Yeah, they also did all the reconstructive, the cosmetic surgery, like the facial trauma, and like all the oral reconstructive surgery after the oral cancer. Yeah, so I think that's a difference between
I have 5 friends in my year that actually just got into, because people in my year that wants to do this specialty, is right now the time to get into medical school. One of my very good friends, Rachel, actually got into Oxford to do medicine, and she's doing that. And a few got into different medical schools. And I mean, everyone has their own preference, but this is not something that I don't know, Dr. Khaw, but it's not a specialty that I want to do. As much as I like doing surgery in the mouth, but putting someone's face into the correct position and cutting tumors doesn't sound like an enjoyable job for me. So everyone is different.
Yeah, I do agree. Yeah, there are different specialties, but I mean, there's no rush to decide which specialties is suitable for you. You can work for a few years first and explore different specialties, go to different courses, different seminars to see which one is more suitable for you and where your passion lies.
Yeah, it's important that, I think Dr. Khaw made a really good point, going to different courses, because these courses, I think some of the people that give these courses, they're not specialists, but they are really good at what they are doing, and they are only general dental practitioner. So it's a good alternative career path that if you go to different courses and you see what they do, and if you can bring it to the members of the general public, rather than putting them through a secondary care pathway, the patients would love you.
Agree.
Isn't it? Yeah.
Wow, I didn't know that you can do so many other things, you know. I mean, the amount of specialties that you have is like tremendous. Right?
Like for me, I'm moving towards the cosmetic side of dentistry at the moment. So I do a lot of like facial aesthetics. So like botulinum toxin, or what people would know as Botox injections, and also fillers, hyaluronic acid fillers. And then I'm doing teeth, like porcelain, like veneers, planning for smile design. So there are a lot of other things in dentistry that you can explore. Like if someone that likes treating kids, they could specialize in pediatric dentistry when they deal with a lot of different cases that comes with pediatric dentistry. That I don't know, does Dr. Khaw like that? But I know that it's not my cup of tea.
Not really for me as well. The kids might scream at your face. Yeah.
Yeah, it's different.
All right. So both of you have been practicing for some time right now. So what's your highlight so far of your career?
Okay, so for me, because I only have been working for a year, so in my clinic is quite a lot of patients, and basically that I mean we a lot of a lot of patients, and we have a long waiting list. So actually a lot of patients, they really appreciate what we did for them. Sometimes they will bring a lot of food like for us, like after we make them the dentures, everything. So it's really enjoyable to see that what patients I mean that the patients are really satisfied with what you have been doing for them. And because some of them, they might have the poor dental knowledge, and sometimes it's good to teach them new things, and they can convey the message to their friends and families as well. So like in our clinic, we do a lot of promotion of the dental public health. So we really teach them like from the basic, like how to brush your teeth, like the correct way of brushing your teeth, the correct technique, everything. And it's good to promote this kind of knowledge to the members of the public. And in government dental clinics, like a lot of colleagues, they really like to have a lot the parties, especially on Friday. We do enjoy that. Yeah, so I would say it's quite enjoyable for me, like throughout this period of time. Yeah.
That's good. I wish I'm at a Jamuan.
One is that? Yeah.
Jamuan. Love a Jamuan, don't we?
Yeah, I love the food.
Yeah. And for me, I think my highlights of my career is that are many. This is one thing that I wanted to say. I'm not saying that I'm saving people's life. I'm not saying that I'm a millionaire. I just won like a lot of like a jackpot and I'm giving money to people, but I'm helping people to get where they are. I don't think that personally, I don't think that mental health is something that is being prioritized in Malaysia. And I do think that by improving someone's oral health, I think there's an implication to someone's overall mental health as well. You're helping them essentially. And I'm not, like I say again, I'm not saying that I'm saving lives, but I'm saying that if I could do transformation, I've got pictures here. So I didn't put it in a presentation, but if I can make someone from here, I haven't finished this case yet, but I'm not saying that this patient's got issues with mental health, but to something like that, it's a different moment for people. I'm not saying that this patient, because I'm just flicking through my phone to see if I've got any cases to show that you're actually helping people recreating their smile. But you have seen these viral videos going on in Facebook that says that this patient in America, that she had no teeth, she's only in her 30s and she couldn't even eat. And the dentist obviously in America was so nice that he actually made implants and stuff like that. So it's things like that that is highlight of my career. Or you help a nervous patient that had a really bad experience in the past to get to coming to the dentist comfortably and laughing with you and willing to listen and understand what you are proposing to them. And that, I think that is the fruit that how am I saying this? Like, it's the highlight of someone's life that makes me happy, and that's the highlight of my career so far. Yeah.
Right. Thanks for sharing all your experiences, Dr. Khaw and Dr. Tay. Right. So, okay, you have students who are, firming up the decision, to apply for this particular course. What are the, advice that you want to give them?
I'll go first. I would say study really, really hard. Make sure that you can't apply dental if you can't apply to any dental school or medical school if you don't work hard enough, because you are competing with everyone in the world to get that 5 slot or that 10 slots that are available in each university. And say if you want to go to King's College London, they might only have 3 students or 5 students. You're competing with a lot of people for that slot, not just from people in Malaysia within your peers. You're fighting people in Hong Kong, Korea, Singapore, anywhere in the world to go into that dental school. So make sure that you work really, really hard. Always do your homework when you are in your A-levels. Make sure you do whatever your lecturer asks you to do. And obviously, when you're doing that, have a good life balance, not just study all the time, but also have some breaks as well. That's my personal opinion. Because I still remember when Mr. Lucas was teaching me, at one point, I remember this was the first 3 months of A-levels, and he was teaching me 1S2, 2S2. I can't remember that already, but it's something chemistry with the bonding. I can't remember that at all. But I remember I had to do that in the middle of the night, like 3 o'clock, because I couldn't get through to it. And I was so surprised that when the next day when I got in, I was the only one who finished the homework and no one else did. I don't know if he remembers it, but this was 10 years ago. But I remember that because I was just like, you know what, I need to work hard.
True, kid. Yeah, I remember that.
Yeah. Yeah, that was me.
Yeah, and I think I would just tell the students who apply to dentistry, saying that dentistry is a lifelong learning process. It doesn't just stop until you finish your uni. You need to keep on update and develop your knowledge and skills, because like a lot of new things will be kicking in like after you finish your dental school. So like maybe I would say maybe like new classification of a disease, or maybe like last time they didn't have the orthodontic treatment, which is a braces, and now they have orthodontic braces, and even like a Invisalign, like these kind of things. So you need to keep on updating and developing your knowledge and skills. Your your dentistry doesn't just stop after where you graduate. And have some life outside dentistry as well, because your life isn't defined by dentistry alone. So you must have the hobby that keep you sane while you're studying dentistry, because it can be quite challenging. So have some hobbies, and yeah. And when I was in the UK, I really enjoyed the time traveling outside UK. Yeah, because like we have a lot of breaks, like a winter breaks and the summer breaks. So yeah. So I really enjoy traveling a lot when I was in the UK.
Yeah, because you will have Malaysian friends that might not be doing dentistry, because you can't keep talking about teeth with people that are in the same cult. Sorry, I used the word that. You don't want to talk about teeth, because sometimes when you finish work, or when you finish uni, or when you finish work, the last thing you want to talk about or think about is the shape of a tooth. You want to see people that are on a different path, like your friends are in accounting and finance, engineering. I don't have a lot of medical friends. I'm gonna be honest. When I was in A levels, all my friends are in PE classes or PB classes. I have friends in PM classes, obviously, but most of my friends are all like different things. And it's quite funny that sometimes I do go down for weekend trips. Like even though I live in Glasgow, remember in the beginning when I said that there's less distractions, but I think I give myself the distraction. I actually pay the train ticket to go see my friends in Manchester for a weekend. And you need to know that Italy or Berlin or Paris is just one flight away, 2 hours. Get on the plane, you'll be flying there in no time. It's not from Malaysia, you need to fly 15 hours to get to one place. And I just think that what you say is correct. You need to have a life outside of teeth or whatever it is.
Yeah, that's right. Yeah.
All right, thank you very much again. I think we have come to the end of the session already. There's a lot of firsts this particular session. I think first we have like two genders right, in this podcast. First, we have someone sharing photos on this particular podcast as well. So if you like and find this particular session useful for you, don't forget to actually drop a like, right, and subscribe if you haven't. Yeah. So thank you very much for Dr. Tay and Dr. Khaw again for this particular session. Thank you very much for your time. Right, so if you have any questions at all, right, please comment at the comment section right above, right? If they're relevant, I will actually get them to actually help to answer the questions for you guys, right? So thank you very much. See you in the next
Thank
one.
you.
Bye.
See you.
Goodbye.
Bye.